Hi, today we're looking at 3 nursing theories or models of nursing. The first one is the symptom interpretation model, and this model looks at how an individual interprets a particular symptom. One example of this is pain, and we often ask patients, how do you rate your pain? And somebody might say 10 out of 10, and they look like it. They're looking uncomfortable, they're either restless or they're doubled over in pain, or they have a high pulse rate and look anxious, or you can just see the cues to pain. Another patient might say, I have an 8 out of 10, but I'm okay, I'm coping with it. So even though they might be experiencing a similar pain, they're just handling it or interpreting it differently, and that can be based on models, somebody or on their background. Somebody who's had a lot of acute pain will interpret it differently, whereas somebody who's new to acute pain will look at it as the worst thing that's ever happened to them, perhaps. Or they may have a high pain tolerance, so we talk about that all the time. So symptom interpretation and the subsequent behaviors depend on how a person views the stimulus, such as pain or other symptoms, and this drives how they respond to or manage the pain. A second model we're looking at is the symptom management model, in which we talk about symptom clusters. And clusters of symptoms are 3 or more related symptoms that occur at the same time. So when we look at a patient with breast cancer, there are different clusters. For example, one might be a GI cluster where they're having a lot of nausea that is accompanied by vomiting and maybe changes in eating behavior. When we look at the psychoneurological symptom cluster in breast cancer, we're talking about depressive symptoms, cognition such as memory changes, fatigue, changes in sleep, and pain. And though not everyone will have all of those symptoms, they tend to occur together in a cluster with breast cancer patients, a cluster occurring together. So what's important about this is how we manage the symptoms. We might at one time have said, well, if we manage fatigue, fatigue will get better. Now we say, and you can imagine we've always said it but not thought about it this way, when we manage fatigue, well, then it's likely they're going to sleep better, or they're going to have less pain, or the memory is going to be better. We all know when we're tired students that it's harder to remember things. And depression should be better. So if we can manage fatigue, we can perhaps affect all these other symptoms. So one example of management of fatigue is exercise. If we get somebody who's undergoing chemotherapy for breast cancer to do daily exercise, we know that they're likely to have less of these 5 symptoms than someone who's not routinely exercising. So that's symptom management model. And finally, the Pinwheel Model of bereavement. In this model, we look at the individual as having a unique experience of bereavement. It is a lived experience. It is based on their personal history. For example, if somebody has a loss of a loved one, well, what was their history with that loved one? Were they living with them daily for 60 years? Or is it somebody that they saw once every 10 years? So there's a difference in what their background might be. Did they have shared dreams and hopes? And what was the nature of the death? Was it sudden? Was it a long-standing illness? So we all know personal history counts, and it's at the center of this model. And then we talk about the cyclical movement through grief, that there is an initiating wind, the loss, that starts the grief process, and they cope with it, they deal with the pain, the loss, the hurting feelings. They may have felt stopped at the time of the loss, that they couldn't go on, but hopefully they are work through that process. So there's an initiating force and they get better. And then another loss may happen, or it may be it's a 1-year anniversary of the death of a loved one, which starts them cycling again. So this loss or this feeling of loss comes back to the forefront. it's like a wind that starts the pinwheel spinning again, and the patient has to work through the grief process again. So cyclical movement through grief is what's important in this theory versus other theories where people are thought to have stages of grief, and it's a very sequential process. Here it's like there's cycles of grief going on. So thanks for listening to these different theories, and I hope they help you as you practice nursing.